to see the WHO classification. We're going to see the WHO classification, and this is what? This is of the AML. That is the acute myeloid leukemia. Let's write it down. Acute myeloid leukemia. So here we are focusing on the 5th edition of the WHO. So according to the 5th edition of the WHO classification, it classifies acute myeloid leukemia. So what is the classification? So AML with there are different categories. That is, firstly we are seeing the AML, and this is with defining the genetic abnormalities, with defining the genetic abnormality. So with defining the genetic abnormality, what do we have? So here there is gene. There is gene or the chromosome change. So there is gene or the chromosome changes. So what are included under this? So under this there is the acute. There is acute promyelocytic. There is acute promyelocytic leukemia. There is acute promyelocytic leukemia. And what does it include? It includes the PML or the RARA fusion. The PML or the RARA fusion. Next, the other component is the AML. There is an AML with the RUNX1 and RUNX1T1 fusion. Next is the AML with the CBFB MYH11 fusion. Then is the AML with the DEK NUP214 fusion. Next, the RBM15 MRTFA fusion. Then we look at the AML with the BCR ABL1 fusion. Next is the KMT2A rearrangement, and there is also the MECOM rearrangement. Next comes the NUP98 rearrangement. Then is the NPM. There is NPM1 mutation, the CEBPA mutation. Then comes the AML with the, so there is AML, and this is with the myelodysplasia related. Next is the AML, and this is with the other defined genetic alterations. Next we look at the AML, and this is defined by the differentiation. So what is included here? So this includes the AML with the minimal differentiation. So AML with the minimal differentiation. Next, the AML without maturation. So there is without maturation. Next is AML with the maturation. So there is with maturation. Next, there is a classification of, there is acute basophilic leukemia. Acute basophilic, there is acute basophilic leukemia. Then there is also the acute myelomonocytic leukemia. Then comes the acute monocytic leukemia we already saw. There is acute myelomonocytic, that we saw myelomonocytic. Now it is acute monocytic leukemia. Then comes the acute erythroid leukemia, and then there is also the acute megakaryoblast leukemia. So other few points we need to know is that the most of the AML with defining genetic abnormalities are diagnosed with less than 20% blast. So most of the AML defining genetic abnormalities, they are diagnosed with less than 20% of the blast. So there are some exceptions. So this is except AML, and this is with, plus meaning with the BCR next to the ABL1 and the AML, and this is nothing but with the CBPA mutation. So the CBPA mutation that require at least 20% of the blast. So it requires at least 20% of the blast for the diagnosing. So this was about the WHO classification of the AML, and we saw the 5th edition, and we saw some classifications. We saw the AML with defining the genetic abnormalities, as well as the AML defined by the differentiations. To learn and grow daily like this, please do subscribe.